Joining us live on the phone from the Ministry of Health, pediatric respirology consultant, Dr. Saad Al-otaibi, to give us more about the program. Welcome, Dr. Saad.
Yes, yeah, hi, welcome. Thank you very much.
Can you start by telling us briefly about the ECMO or ECMO program, please?
Yeah, the ECMO, or the extracorporeal membrane oxygenation, which means outside the body through a membrane oxygenating the baby or the patient blood. It is a form of life support used for babies, children, and adults with life-threatening heart or lung problems. The ECMO provides time for the body to rest and recover by doing the work for the heart and or the lung. This gives the patient time to rest and heal from the underlying disease or illness. It is a modified form of heart-lung bypass and is used for a longer period than the machines used in the operating room during open heart surgery. Why we are using ECMOs? It can be used to provide heart and or lung support for children with a variety of conditions. Children who need the ECMO may have one of the following conditions: either pneumonia, which is infection of the lungs, and we see these cases more often in the winter season from viruses, or cases like congenital diaphragmatic hernias in small babies just born, or cases of pulmonary hypertension or sepsis, or any congenital heart disease, or any case of end-state cardiac or respiratory failure. This ECMO is similar to the heart-lung bypass machines used in the operating room during open heart surgery, but it can be used for days to weeks. And the doctor usually places a tube into the large blood vessels. These tubes can be placed in the child's neck or the groin or into the chest if the child had heart surgery. In our cases, it's only in the neck veins or the groin veins. The location will depend on the size of the child and also on the type of the support needed. These tubes, called cannulas, they are connected to the ECMO machine. The machine moves the blood from the child, extracorporeal, to an artificial lung, or called a membrane. The membrane lung adds oxygen and removes the carbon dioxide from the blood, and then it returns the blood back into the child.
Dr. Saad, since we have you on the phone, could you give us the details of the first operation that took place in Al Farwaniya Hospital?
Yeah, the first baby, this is the first time we do it in Kuwait for babies less than 1 year. And the first baby, he's 5 months corrected age. He's 9 months, but he was a premature baby, so his corrected age is 5 months. He has a severe lung disease. We call it bronchopulmonary dysplasia, or BPD, which is a prematurity of the lung. And he had a viral illness, one of these respiratory viruses, which happen or occur in the winter. And his lungs get damaged, and in spite of the maximum ventilatory support through what we call high-frequency ventilation, his oxygenation was on the 50 to 60%. At that point, because he's critical and he's not responding to the ventilator machines, we talked to our colleagues from the adult ICU, Dr. Mohammed Shamsah and his team, and thankfully, because they are experienced in this technique in the adult population, they helped us to start the ECMO machine on this baby, which he responded dramatically. From the start of the oxygenation or the ECMO, his oxygenation became 100%. So the lungs are resting, and he can, like the machine, breathe for him till he recover from his disease. Okay, the second case, he was a 9 months old, 9 kilo Kuwaiti boy. Also, he had viral illness, severe enough to damaged the lung, so the ventilators are not helping the baby to get maximum oxygenation. So he was started on the ECMO machine. Thankfully, he responded dramatically well. After 3-4 days, he was extubated and removed the machine from him, and he is now very well and ready to be discharged home.
We wish those two children well-being, and Dr. Saad Al-otaibi, pediatric respirology consultant, we thank you for your time.